Hi everybody. I have Cushing's disease. Some people also refer to it as Cushing syndrome. Cushing syndrome is a rare condition that's a result of too much hormone cortisol in the body. Cortisol is a hormone that's normally made by the adrenal glands and it's necessary for life. It allows people to respond to stressful situations such as illness and has effects on almost all body tissues. It's produced in bursts early in the morning. Sometimes they happen at night as well. When too much cortisol is made by the body itself, it's called Cushing syndrome, regardless of the cause. Some patients that have Cushing syndrome, because of the adrenal glands, they have a tumor which causes them to make too much cortisol. Other patients have Cushing syndrome because they make too much of the hormone ACTH, which causes the adrenal glands to make cortisol. When the hormone ACTH comes from the pituitary gland, it's diagnosed as Cushing's disease. Most of the time, it's found in women more than it is men, and usually between the ages of 20 and 40. That doesn't mean that children can't get it as well or be diagnosed that early. The most common reason why someone is diagnosed with Cushing's disease is because of an overuse of a corticosteroid medication such as prednisone, and the levels in their body have stayed high for a prolonged period of time. Cushing's disease is caused by an increase in the hormone cortisol, and cortisol helps to maintain blood sugars, protects the body from stress, and suppresses inflammation. The cortisol is produced by the adrenal glands, which are small glands located at the top of your kidneys. The production of cortisol is triggered by the release of the hormone ACTH from the pituitary gland, and that's located at the base of the brain. The pituitary gland and the adrenal glands are part of the endocrine system in the body that helps regulate development, metabolism, mood, and many other processes. Some symptoms that you can see here: both men and women have round moon faces. Men get gynecomastia, which are breasts, fatty tissue. Osteoporosis happens in both. Women have irregular menstrual cycles, or their menstrual cycle stops altogether, amenorrhea. Women also have hirsutism, which is excess hair on their legs, their face. Both get a fatty buildup on their upper back, which causes them to have a buffalo hump. Basically, they look like someone blew up their abdomen, their chest, and their face, and then their arms and their legs are very, very skinny. Most of the time, these people have high blood pressure, headaches, they have cognitive dysfunctions, anxiety, irritability, depression. They're more prone to infection and getting sick. Most of the time they have type 2 diabetes. I forgot to mention that men, they have erectile dysfunction or decreased fertility. Like I said, the most common cause is the overuse of the corticosteroids or a tumor. And they diagnose them by doing urine or blood tests. They can send them for MRIs or CAT scans. They do a saliva test, which tests the cortisol levels throughout the day. Treatment for this, the best treatment is removal of the pituitary tumor by surgery. And other ways, they can give medication to help control the production of the cortisol in the adrenal gland. And if you don't get treatment for this, or if you're not diagnosed right away, it can lead to bone loss, fractures, muscle loss, like I said, type 2 diabetes, infection, kidney stones, lots of problems. So get it diagnosed early if you know somebody. Thank you.